Hello, everyone, and welcome to HCM Awareness Day. I am talking to you from the HCM Clinic of Northwestern. I'm Dr. Lubna Choudhury, and I will tell you a little bit about our HCM program. It was established in 2008 with the goal of providing specialized, comprehensive state-of-the-art care to patients and families with hypertrophic cardiomyopathy in participation with the HCM Association. HCM is a very complex disease that requires multidisciplinary care, and we collaborate with a number of departments within our hospital to provide that care to our patients. This is an overview of the clinic. We see all sorts of patients with HCM. We are here to, first of all, confirm your diagnosis, test you with targeted testing, talk about risk stratification for all patients, genetic counseling, genetic testing, and we really treat you according to your needs. No two patients with HCM are quite alike, so each patient requires individualized treatment, and we really specialize in that. We have a diverse array of treatments available to you, both through medicines and through invasive therapies that are listed here. And we really believe in a tailored approach and shared decision-making with our patients. We refer all our patients to the HCMA website, and our clinic serves as the center for coordinating these testing and treatment approaches according to the patient's needs. We are a very busy clinic. We see several new patients a month with hypertrophic cardiomyopathy and several more HCM patients for their follow-up appointments. Now, Northwestern has created affiliations with several suburban medical centers, and they keep adding to the list of hospitals which are under the umbrella of Northwestern. So it serves two purposes. We get more patients from these centers referred to us to the downtown HCM clinic. We will be providing an HCM clinic in one of these suburban centers with a physician who is now training with me as I speak. However, that more to come on that later, perhaps next year. But these centers enable our patients who are on Camzyos or mavacamten to have their monitoring echocardiograms done close to their homes. And I can see those echoes and then advise as to their next dosing. Now, if you are told that I do not have any appointments for a long time, it's very likely that we can accommodate you in one of the many extra office hours that I do. Therefore, you can request the patient access representatives at the scheduling desk to send a request to my administrator so she can work on accommodating you earlier. She keeps a running list of people who need to see me, who are waiting to see me, and we slot them into these extra clinics. Where do our patients come from? All over, really. They come from my colleagues at the Bloom Cardiovascular Institute of Northwestern, the Northwestern Medical Group physicians all across our satellite hospitals, regional cardiologists in different states. The HCMA refers us patients who contact them. Other institutions, when patients move to Chicago, they get our name and they come to see us. They look us up sometimes. And of course, family members refer patients to come here. These are a spectrum of the invasive therapies we offer to our HCM patients at Northwestern. So you can see that you can have surgery, alcohol septal ablation, arrhythmia management, arrhythmia ablations, defibrillator implantations, and as well as, doing heart transplantation in the patients most refractory to all treatments that we try. This is the core HCM staff at Northwestern. So there's myself, and I'm joined in this endeavor by Dr. Dominic Fullenkamp, who will also be seeing you as a new patient in hypertrophic cardiomyopathy. So if you're referred to the Northwestern HCM clinic, you may be seeing Dr. Fullenkamp or me. Dr. Robert Bono also sees some patients, but not very many at the moment. HCM genetics experts are Dr. McNally and Dr. Wilsbacher, and I sometimes refer you to them when we get back a lot of genetic details that we are not experts on, but they are. And we have Lisa Castillo as our genetics counselor, who can often do a telehealth visit with you and order your genetic testing. Kayla Mueller is my nurse, who you will be in contact with very often. Brittany French is my advanced practice nurse, as well as Mary Caletta, whom we have also trained to do this. We also are affiliated with the Lurie Children's Hospital of Northwestern, And the cardiologists there are listed here, and their patients, often when they reach adulthood, come and see me in the HCM clinic at Northwestern. So Joan Draves is our administrative lead, and my administrators are about to change as I speak. So Maria Fernandez will be my new administrator, changing over from Abigail, who has served me until now. Here is listed our clinic number, and you can call this clinic number and schedule appointments to see us. This is a picture of all the surgeons that we have at Northwestern doing surgery for HCM patients. The main two are here, Dr. Doug Johnston, who joined us recently. He is a world-renowned surgeon, and he has a special interest in HCM surgery, so we're thrilled to have him join us. And we also have Chris Mehta, who's been doing HCM surgeries for some time. Dr. Patrick McCarthy used to do most of these surgeries. He's pulling back a little bit on that. These other surgeons are excellent surgeons who have done HCM surgeries for us, including transplants and unroofing of the LAD in an HCM patient, so on and so forth, specialized surgeries. So we are all happy to have them collaborate in the care of our patients. This is a picture of the electrophysiology group of physicians at Northwestern who see my patients. I send patients to all of them, and they are all experts at arrhythmia management, implantation of defibrillators, and so on. This is Dr. Jim Flaherty, who does my alcohol septal ablations, and he's an expert in that. And he also does concomitant stenting of a coronary artery if needed, and so on. These are an update of the clinical trials that are going on in hypertrophic cardiomyopathy at Northwestern. You can see some of these trials have been completed already, but I want to really draw your attention to the Sequoia HCM study. And I really want to see more of you enroll in this study, because this is a very important study evaluating aficamten for the treatment of obstructive hypertrophic cardiomyopathy. It's a cousin of mavacamten. It's a similar drug, but it's a second-generation myosin inhibitor. And we really want to see symptomatic obstructive HCM patients before they're even on any treatment to just come to us and talk about this trial, because it's only 6 months. So if you're not too symptomatic, you can be on this study, and it's a placebo-controlled study. So you have a 50% chance of being on the real drug versus not. But if you're not too symptomatic, then it may be a good option for you, and it would give us a wealth of information. So that's a plug for the Sequoia HCM trial that we are pushing for. Imbria, the Improve HCM study, is still recruiting for non-obstructive HCM patients who have symptoms, and we hope to wrap up recruitment, as I understand, by April. So you have a little window to join this study if you wish, if you have non-obstructive HCM. So this is the number of our clinic at Northwestern. I want you to make note of that, and thank you for your attention.